Now, Rob Williams is from the Ontario Telehealth Network, and Rob joined us 2 years ago at the 2014 conference. So it'll be interesting to see what has developed in 2 years from Ontario, and also to see where Rob's taking the Ontario Telehealth Network. I'll just give you a quick précis on Rob. Rob is the Chief Medical Officer of the Ontario Telemedicine Network. In this capacity, he provides strategic leadership, advocacy and support for the organisation's medical interests. A family physician, Dr. Williams began his practice in Timmins in 1976, where he served as the Chief of Staff for 15 years. A co-founder of North Network, Dr. Williams has served as a member and chair of the Canadian Institute of Health Information Physician Advisory Committee and the Ontario Medical Association Committee on Hospitals, as the Commissioner of the Ontario's Health Servicing Restructuring Committee, and as a member of the Registration Committee for the College of Physicians and Surgeons of Ontario. Phew. So he's been a very, very busy man in his life. So Dan, are we right to go to Dr. Williams now? Yep, he's on there. Hi Rob, how are you?
Very well. Good morning to everyone and good evening to everyone else here in Canada.
So we'll let you go with your presentation, Rob. Is that okay?
Yes, very well. So Dan, I think you're going to put that up now for me, and Dan's going to run it while I speak to it. Thanks, Dan. So it's a pleasure for me to speak with you today, and it's been 2 years, I guess, October 2 years ago when I last spoke at this conference. So next slide, Dan. I'm very pleased to have the opportunity to give you an update of where we are going in Canada, and I know we won't have a lot of time for questions at the end, but I certainly hope that I can learn a little bit more about where you're going and what you've accomplished in the last 2 years as well. So I'm going to very briefly review Ontario, Queensland, and our similarities and some differences. And I'll move into what we're up to in Ontario in terms of our healthcare reform, as well as what we're doing to support that reform with our network, and finally where we're going into the future. So next slide. And next one. So this is, of course, Canada, and we are actually quite similar in size and in population. So we both have countries, next slide, Dan, that are quite large and with not that many people. And we have very similar per capita and healthcare spends as well. Next slide. And comparing Queensland as a state to Ontario as a province, next slide, you can see again we're pretty similar in land mass, and although our population is a little more than yours, it's not extensively greater, and we're spending about the same amount on telehealth as per person, as well as our overall healthcare spend. One difference is that you spend quite a bit more on travel subsidy than we do. Next slide. And again, Dan. So our health system is evolving very much like yours. There's constraints on funding from the government. There's a lot of changes happening in the healthcare system. As a whole, people are more interested in paying for quality outcomes and not for volumes. There's a lot more interest in coordination across the various care sectors. And then there's an explosion of innovation going on. I think that the digital world is finally going to start catching up with the retail world and the banking world in healthcare. Next slide. And in Ontario, I'm sure it's not dissimilar to Queensland, our government's very interested in patient access, improving patient access to care. in connecting all of the different players, keeping the patient well informed, much more informed than typically in the past, and of course, giving them high quality care. Next slide. Of interest to me is when you look at the health survey, you're doing quite well on a couple of categories where we're doing very poorly. And I'm just needing to look at my slide here, there. So, in primary care in Queensland, or at least in Australia, 71% of people say they can see a provider within the day when they need to, and we're doing quite poorly. In fact, we're the bottom of the heap of Commonwealth countries. We're at 45%. And then on the last column, you have a fairly high wait list, or we have the fairly high wait list for specialists. You're in your country, about 64% of people see a specialist within 4 weeks, only 46% in ours. So those are two factors that our government's very interested in improving on, and we're here to help as OTN. Next slide. And the shift in the healthcare environment is very real, I'm sure, where you are, as it is here. We're moving from a provider-orientated service to a patient-centered service. We've typically been in silos: acute care, hospital care, community care, long-term care, mental health care, and now we're really moving to team-based care. So that all these silos are much better connected on behalf of the benefit of the patient. Where we've got fragmented databases that are being consolidated so that information follows the patient easily. And we're moving away from bricks and mortar facilities where healthcare is delivered to healthcare anywhere. So if it's more convenient and timely for the patient to be home or at work, we're looking at how to serve them there with their healthcare rather than them having to move to a bricks and mortar. Next slide, and the next one. So we started back a long time ago, with video conferencing, room-based systems. Unlike today, I think you're being communicated through a PC that Dan's got. You don't have the typical big camera, heavy-duty equipment. It's very light and portable. But that's how we started, with video, connecting the northern parts of our province to the southern part. Next slide. And then the next slide. And now we're transforming away from being a service provider of telemedicine to being more of a platform for people to come and use telemedicine services. And we're doing a lot of testing and scaling of new virtual care models of care. We're figuring out how to align with the priorities of our government, how to improve primary care renewal, and make it easier for people to get same-day service, looking at how to support team-based care, looking at how we can integrate with the broader e-health environment, the vendors, the third parties, other providers that are providing virtual care, and not duplicate it. And of course, we're always looking for ways to be more efficient as a company, to do more with less, which is, I think, a very common theme in healthcare. Next. And so one of our major transformational efforts is the OTN platform, and it's a single website where a provider can go to get one-stop shopping for all of our services. And I'll talk about those a little bit further in the presentation. Next slide. So going forward this year, our 4 prime strategies are what we call Healthcare Anywhere, Virtual Healthcare Marketplace, primary care, and then engagement and distribution. And I'll speak to all of them in a little more depth. Next slide. So the first one is healthcare anywhere, and next slide. So our key principles here that we're trying to do is we're trying to develop a core set of telemedicine applications that's available anywhere in the province. We're trying to reduce the costs of doing that by leveraging technology from third parties, from vendors, and driving economies of scale. We're very interested in making it as simple and as easy to use for the providers as possible. And one of the things we're really working hard at is developing APIs for any third-party solution so that we can plug them in to our hub and then they can be used by providers anywhere in the province. Next slide. One of the important assets that we're developing is our directory. And it's a, and then I'll go to the next slide. And the directory is really a platform that we've developed to help referring healthcare providers find the right consultant when they need help. So we're not looking at putting the typical name and this is what you're specialized in and this is where you live only in this directory. We're also working to have people tell us what they like to do, what they're open for business for. Like we have a neurosurgeon that only does psychotherapy now. We have primary care providers who specialize in the care of HIV patients. We have orthopedic surgeons who only want to do low back pain and don't operate. So if we want to be a one-stop shop for everyone in the province, we realize we really need to have a very strong directory where people can find a consultant when you need help that is geared to exactly the problem that your patient has in front of you. And so we've revamped our whole directory to be able to search people on those attributes. You'll still also get to know their address, their phone numbers, their emails, and all of that sort of thing, but it will make it very simple for any primary care provider to find the right help very quickly and easily within 2 or 3 keystrokes on the directory. Next. We're continuing with what we call our e-visit and next, and that's really typical of the specialist seeing the patient remotely and providing care. Next slide. But we've worked very hard to deliver a service where people can connect to their patient wherever they are. So typically a patient has had to go to a room-based system in a facility. So now we're using our home visit, our OTN invite, so that providers can connect to the patient at their home, at their work, 24/7 if they care to, but at the convenience of the patient. Next slide. We're continuing with e-visit. I'm not seeing the slide, Dan, so I'm not sure. I'm just seeing the audience. So I'm not sure if you can hear me and see me. Are you still seeing me, Dan?
Yeah, we're all good. You can continue.
Okay, thank you. So I can't see the slides right now, so I hope you're still on OTN invite. And then go to the next slide on e-visit emergent. As part of an e-visit, we are looking at urgent medicine, things like stroke support for acute TPA, things like emergency consults to a tertiary intensive care unit or critical care area, so that more community hospitals, when they have a critically ill patient, can get very quick advice on managing their patient. Next, is eConsult. And we're also developed an e-consult service so providers can ask a question of each other. So it's a service, next slide, designed around patients or providers with primary care providers who have a patient that they not quite sure how to manage, but they don't think that they need to see a specialist. They can ask a detailed question to the specialist, send an email, photographs, whatever, lab results, and within 24 hours, 48 hours maximum, get a response back from a consultant so that they can continue managing the patient without a face-to-face referral. Next. eCare is our direct-to-consumer services. Next slide. So I hope you're looking at chronic disease management. You'll see that for us, the most expensive types of hospitalization are around respiratory disease, COPD and pneumonia, and heart failure, cardiac issues. So next slide. We have developed a very extensive telehome care program for CHF patients and COPD and asthma patients, where we install monitoring devices into their home for pulse oximetry, for blood pressure, for weight, all automated, uploaded into software. And those parameters are monitored by telehome care nurses who coach the patient in a structured coaching system for about 4 months so that they learn how to self-manage and they learn about themselves and their disease so that they're much more empowered patients at the end of the 4 months. Next slide. And we've had very dramatic results with almost 60% decrease in the ER visits after going through this program, and almost 70% reduction in admissions for the cohort of patients that have gone through. And we've now got about 5,000 patients in the province that have gone through the program. Next. And we're now looking at the less ill chronic disease patients, the patients with diabetes, with mental health. How can we support them wherever? So we've got 3 significant apps in pilot to support them at home or work, where the diabetes app coaches, it uploads their glucometer readings, it takes in input around their eating and their diet, it knows all their medications, and it monitors their disease, and every month generates a report, a one-page report that they can share with their family doctor to show what's happened very comprehensively over the last month. With mental health, we've got a big white wall. I think that they're also in Australia. I'm not sure if they're in your province or state, but I think that they are in at least one state, where it's more of a social media community for people with mental health problems to anonymously sign in and form groups and share experiences with each other. And all of their postings are monitored by a social worker or a mental health provider. And if things are starting to go off the rail, they're there to intervene and to support the individual or the group in appropriate ways. And finally, we're looking at people on home peritoneal dialysis with another app, and how to manage their supplies, which are very complex and difficult to keep on top of, coaching them on their disease, their blood work, and just helping them with instructional videos to help them better manage their peritoneal dialysis on their own at home. Next. We have a significant learning component on our hub. Next slide. So that people can get into real-time experiences like we're doing right now. A lot of them are archived. Some of them are designed strictly for e-learning asynchronously. And we now have about 400,000 users attending educational events a year at their convenience from wherever. Next one. We've even developed specialized hubs. Our first one, learning hubs, was on geriatrics. So we have 12 one-hour lectures by experts on a variety of different topics in geriatric. And it's been a very well received asset in the geriatric world. Next is our second strategy around primary care. And the next slide is our areas of focus are looking at e-visit pilots. And we are looking at a couple of defined geographies of populations of about 100, 150,000 patients, and developing tools so that all the providers in that geography can offer same-day services to this geography of patients. And that's one initiative. Another is looking at how we can connect the circle of care in a more effective way digitally. And thirdly, how we can enhance high care needs patients, the frequent flyers to emergency, how we can better support services to them digitally to help them avoid running to emergency and high-cost healthcare facilities. So the next slide is, hopefully you're seeing a diagram of our model around same day so that patients can call a 1-800 number or email, and a nurse will triage that communication, either solve it, the nurse themselves, or dispose of the request by arranging a same-day appointment with an appropriate provider, connecting with a provider who can then do a home visit virtually perhaps, whatever it takes to keep that patient enabled. They also can do prescription renewals, appointment, help people get appointments with their provider, all electronically, all on the one visit. So the next slide is some of the models of care that we've been supporting in primary care. I think I've already reviewed the ones underway, but the coming ones is we're looking at how to support palliative care patients, wound care, and post-op follow-up digitally in these defined areas. And finally, the next one is called Practical Apps, and it is a new service that we just launched a couple of weeks ago. The web site is, or the URL is at the bottom there, and we are every month, sometimes twice a month, going to be reviewing a common chronic problem dealt with by primary care. Our first one was migraine headaches, and we give a very short overview of the problem, and the focus is on, we've culled the World App Library, the iStore, and we've identified what we think are 4 very strong apps that a provider can prescribe to a patient who's having a problem in this area. And we give a very brief review of the app and a link so that the provider can easily push it to their patient and ask their patient to use the app for a month and come back and see me, and we can review the results. So we've got, as I say, 1 or 2 clinical conditions that we'll be presenting a month, and look forward, if you get a chance to look at it, to tell us what you think. The next one is our virtual healthcare marketplace. And on the next slide, what we're really doing is we're looking at existing resources and existing services in third parties outside of OTN and validating them to an extent where we can link them onto our hub and provide those services to any of our providers who would want to use them. So the next slide is our role as a broker, and we're looking at identifying a value and evaluating the best technologies that would support a particular model of care, brokering them to make them available to our members in Ontario, looking at value props and business models that are scalable for this investment, sometimes piloting them if they need to be piloted to develop some evidence, and then looking at how to help people adopt them into their practice. So the next one, our fourth strategy is engagement and distribution. And if you go to the one with the green header on engagement and distribution, I think the really important thing here is that we're really thinking strategically about coalitions of the willing. So everything that we do, we're looking at who are the stakeholders that we need to engage to make this sort of service or this model of care work. Who are they? What attracts them? What would engage them? How do we engage them? And then deliberately planning a course of action to get all of the key leaders around this model of care engaged, involved, knowledgeable about leveraging digital care in that area. So these are our four main strategies, how we hope that we can best engage the transformation that's happening in healthcare and leverage the assets of OTN and telemedicine as effectively as possible in supporting this transformation. Next slide is OTN by the numbers, and I'm at the very end. Just very quickly to boast a little bit about what we've accomplished in the last year. So the first one is how patients have benefited. So we've served over 600,000 patients. We've done about 18,000 direct to the home visits. And for those people living in remote areas, we've saved 121 million plus kilometers of travel. The next slide is how providers have benefited. And so, as I said, we've had over 300,000 people in our learning channel. We have about 22,000 people actively using our hubs now. We've done over 10,000 e-consults, and our average response time is under 5 days. And my last slide is on how the system has benefited. And we've been able to demonstrate over $54 million the government has saved by travel avoidance. And 61% of our events are now, clinical events are now occurring in the community outside of hospitals. And, as I said earlier, with our home care, we're seeing a significant decrease in hospital events. So we're able to show and demonstrate some real improvements. And that, with my next slide, is my last slide. And I'm exactly 5 minutes left.
Rob, I think we're all stunned here. Here we are. We're probably leading in Australia with telehealth, but I think it's like a Volkswagen against a Ferrari at the moment. So that's impressive. It's really impressive, and it gives us opportunity and the strategies to go forward. I'd like to ask the audience if there are any questions of Rob. Yeah, just down to the mic if you like. Yeah.
Hello, Rob. I was just wondering, the patients, when they log on to get to a practitioner, are they new patients to that practitioner, or new and review, or only review patients that can be seen?
Are you referring to the directory that I was speaking of?
Yes.
The directory is geared for providers, not for patients. Okay. So at this point, we have not figured out how we want to open up parts of that directory and the information in the directory to patients. We are planning to do that, but right now it's for providers. So it's a way for primary care providers to find a consultant, and it's a way for consultants to, in essence, advertise what they're wanting to see and get referrals about.
Thank you very much.
Matt?
Hey Rob, it's Matt. How you going?
Hi, Matt.
Hey, just in reference to your last slide, where you had those really nice metrics, we probably need to talk out of session about those. But look, that slide is a wonderful representation of the impact that OTN's made, particularly on expenditure, travel. Also, really interested in the eco aspects as well. So we'd love to talk more about, how you came about those figures, what formulas did you use, what we found in terms of trying to look at what is the return on investment in telehealth as a maturing service. It's proving a little difficult to come up with anything other than fairly arbitrary formulas. So can you throw any light on how you came about those calculations and figures?
Well, it's something that we've been putting energy and resource into. We have affiliated with a research arm of a major teaching hospital in Toronto that is an evaluative resource. So we have been spending a lot of time with them, working through just the sorts of metrics that you've referred to. And we also have in-house, we have 4 people now who really focus on our data and mining our data in meaningful ways so that we can report outcomes to key stakeholders like government, and we'll be happy to talk to you further about it.
That's great. We might have to pop over for that visit then.
Anytime, or we can visit.
And-
We'll gladly come back.
And Rob, I just have one more question. You said you went from a telehealth service provider to the telemedicine platform. Was that a conscious decision, or it was just a natural progression, or did it morph into to the platform?
It was a natural progression and also some economic imperatives. When we started in the business, the technology was quite immature, and if you wanted software and hardware, you really had to either design it and build it, or there just wasn't many options to procure it, and there wasn't really any third-party vendors who were supporting it. It's really changed now. There's a lot of people, especially in the United States, that are offering online, see a doctor. There's lots of things happening in the app world. There's the cost of the video technology has gone down hugely, especially when it's now software based on PCs and computers and mobile devices, and then the software to support scheduling and connecting. There's just a lot of people out there now who are building products and trying to sell them. So we really felt that our resources were better spent on thinking about what are the models of care, how can we help people adopt them, what are the technologies that other people are building and supporting that we can leverage to help people digitally do these new models of care, and that our expertise was not in delivering the service, but in doing the thinking behind the service and really working with providers on the change management. So that's how we moved away from what we used to do to this platform-based approach and service approach.
Okay, thank you. Ladies and gentlemen, could you thank Dr. Rob Williams from Ontario?
Have a great rest of conference, everyone.
Thank you.